Hello, I am Dr. Binju Joel. Today I would like to talk to you about how semaglutides like Ozempic and Wegovy and tirzepatides like Mounjaro and Zepbound make patients lose substantial amounts of weight. So Zepbound is approved by FDA for weight loss, and Mounjaro is approved by FDA for diabetes, and these both are tirzepatides. And among semaglutides, Ozempic is approved by FDA for diabetes, and Wegovy is approved for weight loss. Let's see how these medications, when taken properly, how they make patients lose weight this much. They're also very good in improving your cardiovascular health. Up to 20% improvement in cardiovascular health is found by taking these medications. So if you kindly look at this picture I'm showing you, you can see that these medications are agonists of glucagon-like peptides. Glucagon-like peptides, or GLP-1s, are natural hormones found in the body. So they mimic their action. So their actions include, at the brain level, they increase your satiety, which leads to reduced food intake, which naturally leads to loss of body weight. Because of this mechanism of action, they also cause nausea very frequently. At the pancreas level, they improve the insulin secretion. They reduce postprandial glucagon release, which means release of glucagon, which is a storage form of glucose just after you take a meal. At the stomach level, they decrease gastric emptying, which leads to improved feeling of fullness or satiety, and naturally we eat less food, and which leads to reduced body weight. At the systemic level, which means all over the body, there is reduced blood sugar level or hyperglycemia, which leads to significant improvement of diabetes. If you look at the liver level, the GLP-1s improve insulin sensitivity and reduce insulin resistance. Insulin resistance is commonly found in diabetes and weight gain. They also reduce liver production of glucose. They also reduce deposition of fat in the liver, which means they reduce fatty liver. Fatty liver is a leading cause of liver failure in the United States right now because of the increase in obesity found in the United States. So let's move over to the GIP-1. GIP-1s are glucose-dependent insulinotropic polypeptides. It's a mouthful to say. We can just say GIP-1 for now. So tirzepatides have this action, whereas semaglutides don't have this action. Tirzepatides have both the GLP-1 and GIP-1 action again. So the GIP-1s at the central nervous system or the brain level, they reduce food intake and they reduce body weight. So they also increase your satiety. But because of that reason, they cause some nausea, but the nausea is much better than the amount of nausea caused by the GLP-1s. At the pancreas level, they improve insulin production. So they increase glucagon production as opposed to the reduced glucagon that's found in the GLP-1 action. At the subcutaneous level, you can see multiple levels of action, but the gist of it is they improve insulin sensitivity. They reduce inflammation at the subcutaneous adipose tissue level, especially around the abdomen. So actually, they lead to improved abdominal fat deposition. And at the systemic level, they reduce glucose in the circulating bloodstream, which leads to significant improvement in diabetes. They also reduce triglycerides in the body. So at the skeletal muscle level, these medications improve insulin sensitivity. They increase the metabolic flexibility of the muscles. They also reduce fat deposition in the muscles. So we come to the conclusion of this talk. Hopefully, you understood the difference between GIP-1s and GLP-1s and understood how these medications improve your metabolic health and also improve diabetes if you have diabetes, and also improve your body weight.